Hello, I'm Nakia Basharuddin and this is Nightline, news making the headlines. United States projects up to 240,000 deaths from COVID-19. And any travel to buy food and daily necessities restricted to 10 kilometers under second phase of MCO. Welcome. The government has limited the distance a person can travel to buy food and other essential items to within 10 kilometers of their home as the country tightens control in the second phase of the Movement Control Order, MCO. The same rule also applies to those who are seeking healthcare or medical services. This is according to a federal gazette that was uploaded on the Attorney General's Chamber's website on Wednesday. The Gazette stipulates that this movement condition applies to any person who moves from one place to another within any infected local area or from one infected local area to another infected area. It also states that when traveling, a person shall not be accompanied by another unless it is reasonably necessary, while those who are out to perform any official duty, including for essential services, shall carry with them an authorization letter from their employers. Malaysians who need to leave the house for any other special or particular reason are also required to obtain prior written permission of the police. Any person who contravenes any provision shall, on conviction, be liable to a fine not exceeding 1,000 ringgit or to imprisonment not more than 6 months or to both. Under the updated Gazette, the list of essential services has also been cut from 22 to just 10. Among the notable services to be excluded in the updated list are hotels and accommodations, port, dock and airport services, postal, broadcasting and wildlife. Under the MCO, which is currently scheduled to end on April 14th, only those working in the essential services are allowed to travel to work. In a related matter, police's request for people to produce their electricity or water bills to check their home address during the Movement Control Order MCO is aimed at preventing people from cheating during the period. Inspector General of Police, IGP, Tan Sri Abdul Hamid Badr said there was no specific law on producing such bills, but it was at the discretion of the officers and police personnel on duty. He said police did not refer to the home address on MyCat as most people did not change their address. The IGP said police do not want the people to cheat during the investigation. He went on to say that if there is an electricity bill, police will know where they are. Tan Sri Abdul Hamid gave an example of people living in Gombak who traveled to Kuala Lumpur to buy things. This was the reason, according to the IGP, that police encouraged them to bring electric or water bills to assist during the inspection. The Domestic Trade and Consumer Affairs Ministry said on Wednesday its permits for food and healthcare companies to operate during Malaysia's Movement Control Order MCO has been extended to April 14th. This after the government decided to continue implementing the MCO to curb the COVID-19 pandemic. The Domestic Trade and Consumer Affairs Ministry in a statement said that the permit extension is also given to these companies to put their machinery and equipment on standby. The ministry, however, said business operating hours during the MCO is subject to other instructions from the National Security Council, state governments and local authorities. The ministry hopes that industry players will provide full cooperation during the MCO period and obey the business operating terms and conditions that have been set. It said that employers have to prepare a copy of the ministry's approval letter, together with a list of employees, to ease their employees' movement. The MCO, which was initially scheduled between March 18th and 31st, requires non-essential businesses to stop operations, while the public has been ordered to stay at home to curb the COVID-19 outbreak. Last Wednesday, Prime Minister Tan Sri Muhyiddin said the government decided to extend the MCO until April 14th, as updates from the National Security Council and Health Ministry indicated an increase in COVID-19 cases. Malaysia has recorded its highest number of COVID-19 recoveries in a day, with 108 patients discharged on Wednesday. Describing this as a good sign, Health Director General Dr. Nur Hisham Abdullah said the cumulative total COVID-19 patients who have recovered is 645.
Yes, today is the highest recovery compared to those that have been discharged. And it takes some time, perhaps about 2 weeks before we can discharge them. And this is actually a good sign that our recovery rate is improving, right? So before discharge, we need to have 2 samples within more than 24 hours. 2 sample, negative sample, then only we are able to discharge the patient.
At his daily media briefing, the Health DG said the nation recorded 142 new COVID-19 cases, with 2 more deaths reported, while 102 others are being treated in the intensive care unit ICU. To date, the total number of cases in the country stood at 2,908. The 2 deaths were that of an 80-year-old woman who was diabetic, hypertensive and a heart patient, while the other was a 62-year-old diabetic man who was hypertensive as well. Dr. Nur Hisham also pointed out that after 2 weeks of implementing the Movement Control Order MCO in Malaysia, figures show early signs that the mitigating activities introduced by the government and other relevant agencies have worked. He, however, stressed that Malaysians must continue to maintain their social distancing and to obey the stay-at-home order for the upcoming weeks. The Prime Minister's Department, through the National Housing Management Division, has offered government-owned accommodation to frontliners battling the spread of COVID-19 as a gesture of appreciation and support. The division's public relations unit, in a statement, said as of March 31st, it had prepared 2 federal rest houses known as Rumah Peranginan Persekutuan, or RPP, and 4 transit homes for the purpose. The accommodation is to be used by Health Ministry and National Security Council staff, some of whom were struggling to find lodgings while working long hours both at medical facilities and on COVID-19 enforcement operations. The statement said 2 apartment units at the Putrajaya transit homes have been allocated to the Health Ministry since March 27th and NSC staff since March 31st, respectively. While 9 deluxe rooms at the Cameron Highlands RPP have been occupied by the Health Ministry personnel since March 30th. Meanwhile, 3 deluxe rooms at the Pulau Pinang RPP will be opened for Ministry staff from April 2nd. The Welfare Department will also use cafeterias and federal buildings as food collection centres before aid is distributed to the public. In dealing with the COVID-19 pandemic, a team of local professionals have come forward to formulate a special program aimed at providing assistance to frontliners. The Safe Space program was set up with the goal of providing counselling, art therapy and psychological assistance to help those dealing directly with the crisis. The Safe Space program aims to reduce the risk of stress and mental illness among the target group. Based on the spiritual psychosocial model, it is expected to increase the resilience of individuals as well as strengthen hospital resources to collectively deal with the pandemic. Its key drivers are clinical psychologists, registered counsellors, psychiatrists, social workers, and public health researchers.
The first level is the basic survival and security, and we will have our NGO partners and volunteers helping to ensure that our key populations have the basic security. And the second level of care we are providing is what we call social connection. So on our platform, we try to create a virtual support group for people who are looking for sense of belonging, and this is something very important during time like isolations. And after that, we have the third level of care for those who have some kind of persisting feeling of distress. We will do some kind of psychological first aid approach. It's not a therapy. Psychological first aid is a PFA. It's for crisis management. It's one-time consultations to relax and calm people's mind and connect the resources they need. So after that, if the person still need more intensive care, we will refer them to our level 4 of psychiatrists and psychologists therapy.
The team also works with a number of non-governmental organizations, NGOs, and volunteer organizations. Discussions are held online and help is made available through their Facebook page, Safe Space COVID-19, where patients will be placed under their respective categories while their identities are kept confidential. Former Prime Minister Tun Dr. Mahathir Mohamad on Wednesday said that the country's economy will eventually recover from the global COVID-19 pandemic once the MCO ends. However, he stressed that this could take longer time as the fundamentals of the Malaysian economy must be rebuilt again.
Ya, ekonomi kita akan pulih apabila kita tidak lagi tersekat dalam menjalankan kerja-kerja kerana wabak ini. Tetapi dia akan mengambil masa yang lama kerana kita harus membinakan asas-asas ekonomi kita semula. Dan kita dapati bahawa tabiat bekerja itu mungkin berkurangan dan kita perlu bangunkan diri kita sendiri untuk bekerja lebih kuat kerana dengan bekerja kuatlah maka kita dapat pulihkan ekonomi negara kita dengan lebih cepat.
Tun Dr. Mahathir said this during a question and answer session via the segment Apa Nak Tanya that was carried live on his Facebook and Instagram accounts. Analysts have said that a global recession is inevitable as business activities come to a halt in many of the world's top economies due to the unprecedented measures taken to deal with the spread of the COVID-19 virus. Tun Dr. Mahathir also said the probability of COVID-19 being completely eradicated from the country would depend on Malaysians themselves. He thus advised Malaysians to adhere to the MCO. The White House projected 100,000 to 240,000 deaths in the United States from the coronavirus pandemic, even if current social distancing guidelines are maintained. They suggest if no social distancing measures had been put in place across the country, between 1.5 million to 2.2 million people would have died. President Donald Trump called U.S. efforts to slow the spread of the coronavirus a matter of life and death and urged the public to heed his administration's social distancing guidelines.
I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel, but this is going to be a very painful, very, very painful 2 weeks.
At the same media conference, Director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci, who is helping to lead the U.S. effort, said, as sobering a number as that is, we should be prepared for it.
This is tough. People are suffering. People are dying. It's inconvenient from a societal standpoint, from an economic standpoint, to go through this. But this is going to be the answer to our problems. So let's all pull together and make sure, as we look forward to the next 30 days, we do it with all the intensity and force that we can.
The global catastrophe has killed more than 4,000 Americans and infected a total of 188,663 thus far. Earlier, a Russian military cargo plane carrying medical supplies to help the U.S. combat the outbreak has taken off from an airbase in Russia after Trump accepted an offer of assistance from President Vladimir Putin. The aid shipment comes after a phone call between Putin and his American counterpart on Tuesday, during which the two discussed the fast-growing pandemic and a major shortage of protective gear in the U.S. It, however, prompted complaints from a number of American pundits who read vague ulterior motives into the gesture, seeing the aid as a useless propaganda ploy at best, or even a pretext for a Russian spy operation. Meanwhile, China on Wednesday reported more than 1,300 asymptomatic COVID-19 cases, the first time it released such data following public concern over people who have tested positive but are not showing symptoms. According to the National Health Commission, NHC, there were 1,367 asymptomatic patients under medical observation at the moment, with 130 new cases newly added in the last day. On Tuesday, the NHC announced that it would respond to public concerns by starting to publish daily data on asymptomatic cases, which it said were infectious. This after there were mass online calls for the government to reveal the number of asymptomatic cases after authorities revealed over the weekend that an infected woman in Henan province had been in close contact with 3 asymptomatic cases. Previously, historical data on those infected without showing symptoms was not published nor added to the official tally unless they later show clinical symptoms. China, where the coronavirus emerged late last year, has managed to bring its outbreak under control and is easing travel restrictions in virus hotspots. But there are concerns that the end of lockdowns will see thousands of infectious people move back into daily life without knowing they carry the virus because they have no symptoms and so have not been tested. Saudi Arabia's official on Tuesday urged Muslims across the globe intending to perform the annual pilgrimage to delay making plans this year, in comments suggesting the pilgrimage could be cancelled due to the COVID-19 pandemic. Hajj and Umrah Minister Muhammad Saleh Benten said Saudi Arabia is fully ready to serve pilgrims and Umrah seekers, but under the current circumstances, the kingdom is keen to protect the health of Muslims and citizens. The kingdom authorities, however, has yet to announce whether they will proceed with this year's Hajj, scheduled for the end of July. Earlier this month, Saudi Arabia suspended the year-round Umrah pilgrimage over fears of the virus spreading to Islam's holiest cities, Makkah, an unprecedented move that raised uncertainty over the annual Hajj. The pilgrimage, which last year attracted 2.5 million people, is a key revenue earner for the kingdom. However, it could be a major source of contagion as it packs pilgrims closely in religious sites. The kingdom's health ministry has reported 1,563 coronavirus infections and 10 deaths from the illness so far. United Kingdom reported a record 563 daily COVID-19 deaths on Wednesday, the first time the national toll has exceeded 500, bringing the total fatalities to 2,352. Some 29,474 people have now tested positive, an increase of 4,324 over the previous day. Britain goes into lockdown last week in an attempt to combat the virus, but Prime Minister Boris Johnson, who himself has tested positive, warned that it would get worse before it gets better. United Nations Secretary-General Antonio Guterres warned Tuesday that the world faces the most challenging crisis since World War II, confronting a pandemic threatening people in every country, one that will bring a recession that probably has no parallel in recent past.
We are slowly moving in the right direction, but we need to speed up and we need to do much more if we want to defeat the virus and if we want to support the people in it. This is not a financial crisis, this is a human crisis.
He stressed that this will only be possible if everybody comes together and if we forget political games and understand that it is humankind that is at stake. The Finance Ministry has announced the appointment of Prime Minister Tan Sri Muhyiddin Yassin as the chairman of Khazanah Nasional Berhad with immediate effect. The MOF in a statement on Wednesday said Tan Sri Muhyiddin replaces Tun Dr. Mahathir Mohamad, who stepped down as chairman and member of the board effective March 25, 2020. The ministry also announced the appointment of Finance Minister Datuk Sri Tengku Zafrul Aziz and Datuk Muhammad Azlan Hashim as the members of the board, also with immediate effect. Khazanah meanwhile thanked Tun Dr. Mahathir Mohamad for his leadership, guidance and contributions throughout his tenure as chairman. Defying movement control order. More ignorant people nabbed. This and more local news when we return. Now moving on to the foreign front. Any major eruption of Mount Fuji would rain so much ash on the capital of Japan, Tokyo, that its transportation network of trains and highways would be paralyzed in 3 hours. A government panel, which is attached to the Cabinet Office, said simulations had shown that even minute amounts of ash from such an eruption would make it impossible for above-ground trains to run in Tokyo, 100 kilometers to the northeast, and weigh on power lines. Apart from traffic and trains that would be brought to a standstill, electricity and water supplies will be cut, with houses crushed under its weight. Visibility would also diminish to zero. An eruption on the scale of Mount Fuji's last eruption could go on for 2 weeks, which the panel included in its calculations. Mount Fuji last erupted more than 300 years ago in December 1707, but it is active and occasionally goes through periods of activity that can produce several hundred tremors a month. Although the country's sacred peak has been quiet ever since, scientists said that a future eruption is inevitable and could come with little warning. In the Republic of Congo, 20 people were killed Wednesday when a lightning strike damaged a high-voltage power line in a suburb of the capital, Brazzaville. The mayor of Kintele, Stella Mensah Sassou Nguesso, said 7 bodies had been sent to a nearby morgue and another 13 to a mortuary in the capital. An eyewitness said lightning cut through 2 high-voltage cables, electrocuting people on the ground. The area was reported to be hit by heavy rains early Wednesday. Ambulances, hearses, security officials, and electric company workers rushed to the scene. Private individuals could be seen taking some bodies and injured people into their cars to take them to morgues and hospitals. The number of injured was not immediately known. Before we wrap up this edition of Nightline, let's take a look at what has been installed on the front pages of Malaysia's main newspapers on Thursday, April 2nd. The New Straits Times publishes a special report on the food distribution for the needy amid COVID-19 on its front page. While the nation's best-selling Malay newspaper, Harian Metro, highlights on the online scams that target EPF contributors who wish to apply for the I-Lestari. Berita Harian focuses on the increasing number of recovered COVID-19 patients, which Health DG described as a good sign. And Noor Hanani's Azman's report on the household loans gets the main stage of the Malaysian Reserve. Be among the first to get your copies today. And a herd of wild Kashmiri goats has taken over an otherwise unoccupied town centre in Wales amid the UK's ongoing lockdown due to the COVID-19 pandemic. In the absence of people, the herd of about 122 goats wandered into the coastal northern town of Llandudno from the Great Orme. The visuals of the herd roaming the town wrap up Nightline this time around. With that, I'm Nakia Bashiruddin. Thank you for watching. And remember, Malaysians, stay safe and stay at home.